There we go. Hello. Thank you guys so much for joining us today.
Thank you, Debbie.
Yeah. So I just want to start out by giving everyone just a little bit of a history of what Asa did during the COVID pandemic. As a group serving medical cannabis patients, we were enormously concerned about the impacts of COVID-19 on our communities. Patients, as you know, are at greater risk for a variety of reasons. So we went straight to work to ensure that the needs of patients were taken into account by those responding to COVID-19. So before states had even declared a state of emergencies and closed non-essential businesses, Asa held an emergency response meeting. I think the date of our meeting was March 15th. So it was like right when everything shut down, when most of the country shut down. We got an emergency meeting with stakeholders, including all of Asa's staff, industry professionals from all over the country, medical, legal professionals, and of course, patients. And we discussed the needs of cannabis patients and what businesses could do to stay open to serve patients while also protecting the safety of their own staff, customers, and their products. So what followed was an emergency call to action. And we actually sent a letter to all governors and directors of state medical cannabis programs on March 16th. So the day after we had this meeting, we sent these letters to every single governor and state program leader as a call to action to ensure that patients continue to have access to medical cannabis and that the supply chain was not interrupted as well, which was very important. While most states were forced to abandon cannabis reforms in 2020 to focus on health and economic challenges posed by COVID, 28 states implemented new program features through their COVID response plans that had been met with broad support from patients. Acknowledging this, ASA included a new scoring category in our 2020 State of the Report that illustrated the value of these important program improvements, which included designating cannabis businesses as essential. That was huge. Curbside pickup and delivery, especially states that didn't have delivery options. That was really great addition. And telemedicine and through program enrollment and re-enrollment into the programs was also an amazing addition. So during today's discussion, we're going to hear from Michigan State Representative Yousef Rabhi and EASA's Nicole Redler about the need for states to permanently maintain these cannabis-related emergency features established under COVID, and the need for states to revisit the primitive medical models they organize to repair key policy gaps affecting patients. So I'm going to start with Rep. Rabhi. Would you like to just do a quick introduction of yourself before I go into the first question?
Sure. Can you hear me okay?
Yes.
Awesome. So hi, everybody. My name is Yousef Rabhi. I serve as the state representative for the 53rd District in the state of Michigan, which represents most of the city of Ann Arbor and most of the University of Michigan campus actually is included in my district as well. In the State House of Representatives, I also serve as the Democratic floor leader within our House Democratic Caucus. So I'm proud to serve both in leadership in the House Caucus as well as a state representative in the 53rd District here. So before that, I served as a county commissioner at the local level, and I've been working on cannabis issues essentially for the entire time that I've been in public office over the last decade. So it's a pleasure to be with you all here today, and I'm looking forward to having this conversation.
Thank you so much. So my first question for you is, I know that you've been a big advocate in the Michigan legislature to improve the state's program to better serve patients through many of the features organized by states under COVID. Tell us a little about Michigan's designation of cannabis businesses as essential under COVID and related reforms, and how the merging of the medical and adult use programs is going in Michigan with respect to preserving or improving key features of the state's medical programs.
Yeah, so that's a great question. Thank you for asking that. So yeah, during the height of the pandemic, we were able to secure our cannabis businesses as essential. And so the industry was allowed to continue to operate with some tweaks. Of course, there were some safety features that needed to be put in place. But by and large, we were able to continue on operating our cannabis industry in the state of Michigan. And that was actually really positive. One of the things that we were able to achieve as well as part of that is that we were able to do an emergency change to allow for medical patients to be able to get their medical cards via telemedicine, which is not something that we had before, but that was a change that we were able to secure through executive action. Now it's something that we're looking at doing from a legislative perspective. I'm part of a bill package that includes that reform to make that a permanent feature in our state law to allow for that telemedicine aspect when we're looking at patients getting their medical cards. So those are both really important features. As you said, Michigan is a unique state because we have transitioned from the medical market, which started in 2008 after our ballot referendum passed, and now after the 2018 recreational marijuana ballot initiative passed, we're now in a fully recreational market here in the state of Michigan, and that has come with a lot of benefits, but it's also come with certain challenges as it pertains to the medical market. One thing I just want to quickly say before I turn it back over is the conversation about caregivers. Protecting our caregivers in the state of Michigan is something that is really important to me. But unfortunately, now that the industry has established itself here in the state of Michigan, it seems that some larger industry players are sort of making a play, so to speak, to reduce the amount of caregivers or the access that caregivers have to grow in the state of Michigan. So that's something that I've been really passionate about, is working on protecting our caregivers, protecting the caregivers that have been operating, and keeping that door open into the future as well. This is something really important for our state, and like I said, that is one of the challenges that we're facing with the transition that we've undergone.
Thank you, and I'm so glad that you're there to help, protect the patients and the caregivers in the program. So thank you for the work you're doing there. My next question is for Nicole, but first I'd like to give Nicole a minute or two to introduce yourself.
Sure. Yes, my name is Nicole Redler. I'm the Senior Community Affairs Manager at EASE. I've worked directly with our government affairs team in amplifying the voices of patients, advocacy groups, business groups, and policy conversations to make for better laws and regulations for cannabis businesses to operate, and also for patients to access legal cannabis. Yes, I'm so grateful to be here. I'm also the Vice Chair of the Bay Area Americans for Safe Access chapter, along with Tony Bowles, which has been an honor to work so closely with such an amazing advocate and longstanding medical patients in the Bay Area, really the birthplace of the medical cannabis movement, and also have had a great opportunity to work with different representatives of ASA at the national level, but also across California. Shout out to Terry Best down in San Diego. So really happy to be here, and thank you for having me.
Thanks, Nicole. So my question for you is, delivery of products from school suppliers, from school supplies to groceries and alcohol, it's all become commonplace these days. And patients of traditional FDA-approved products can also count on delivery for their prescriptions from pharmacies. Your company operates a cannabis delivery company, and I'd like to hear from you about why delivery is so important to patients and why more states need to authorize this important service to facilitate access for patients.
Absolutely. A great question. Also, just before I get started, really wanted to say thank you to Representative Rabhi for all of your amazing work in committing to longstanding medical operators and, providing access to patients in Michigan, which is so huge. So thank you so much for all that you do. It's really important to have those allies to advocate on that level with their colleagues to get these rules passed. So thank you for your work.
Absolutely. Thank you.
Yeah, and also just wanted to give you a little bit of background on what our company is. So EASE is California's largest cannabis employer and largest marketplace for legal cannabis products. So what we do is we connect adult consumers directly with licensed products via our on-demand delivery. So and we're very excited to soon be launching in Michigan. But to get back to your question, delivery is, basically a mechanism to expand access to the legal market. It's really important to have that technology and access to allow not just for patients to access patients to access medicine, but also for legal operators to connect with their consumer base. So we do this through the technology and making it as efficient as possible, just like any other on-demand or delivery service for other goods that brings it right to your doorstep. One of my favorite things recently is, getting groceries delivered. For someone, I live in, an urban setting. I don't have a vehicle. It's so much easier for it to get delivered to my door without that contact, especially during COVID, of, having to get into a rented vehicle or, a ride share, going to the grocery store, being around so many people. This has really kept so many people safe. And obviously, it's a no-brainer to have this service available for patients across California. Another important thing to note is that, many patients, yes, cannabis is legal in the state of California, but over 60% of consumers live an hour or more away from a storefront retail location, which is extremely huge hassle, especially when thinking about, a patient that may be immunocompromised or not have access to transportation, may have, low-income patients that really don't have the time and resources to go get their medicine when they need it. So on-demand delivery is a huge asset for the legal market and for patients in general.
Thank you. Yes, totally agree. Totally at this point, especially that, understanding that people don't always live so close to a dispensary or an access point. So, and nor can they take out the time to drive, 2 hours back and forth. So this next question is for the both of you. Beyond the reforms implemented under COVID that we've been discussing, what other key patient issues do you see as unresolved and in need of repair occurring across states that we need to address? For example, ASA, as you guys know, scores our State of the States report on patient rights, civil protections, sufficient access, consistency of safe medicine and labeling. In each of these areas, we see a lot of room for improvement in most state programs. Are there any that stick out to you as particularly important to fix? For instance, California still has no employment protections for people using cannabis. What other key issues do you feel that are important to fix?
That employment protections piece is really important one, and it's one that we need to address really across the country. I think there's a lot of gaps there. There's definitely gaps in the state of Michigan too. So that's something that we've been looking at. There's a lot of different areas that we're sort of that we're looking at right now. But protecting, as I said, protecting the core of the medical industry in the state of Michigan and the core achievements that were accomplished through 2008 and the 2018 ballot measure, protecting a lot of that from some of the influences that have been coming through has been really important. And even another thing that I want to mention too is the importance of home grow in the state of Michigan. We were able to get some pretty significant gains through the 2018 ballot measure that created an environment where home grow was an important feature in Michigan. And again, because once an industry is established especially through the recreational side, it was a little different when it was just medical, because a lot of the people that were in the medical industry were really in the medical industry for because they were patient-centric, frankly, and they were activists in the cannabis space for many, many years. And that is true to some degree with recreational market as well. But you see some different types of business opportunities that are opening up and different mentality from those business owners. And unfortunately, one of those features is that you sometimes hear people say that they want to reduce or diminish the amount of home grow that people can do. Or as I was saying, for caregivers, they want to reduce or diminish the caregiver market so as to protect the the larger cannabis businesses in the state that are starting to emerge and grow. And that's just something that I think we have a unique situation in Michigan because we have such a strong history for many, many decades in the cannabis activism space. Hash bash has been going on in my district for decades. Ann Arbor was the first community in the country to decriminalize cannabis, to make it a civil infraction. So we have a strong history there, and a lot of activists that have been in the space for a long time. The John Sinclairs of the world, great icons of the cannabis movement are from our community. And so we have a little bit more of a groundswell when it comes to protecting things like home grow or caregivers to push up against some of these bigger business interests that are trying to corner the market.
Absolutely. Those were amazing points. And I agree with you when it comes to home grow. That's such a huge issue, not only in Michigan, but also in other states across the country. In California specifically, medical patients' protections were really hindered during the move from the medical industry when Prop 64 was enacted, and seeing that the compassionate care compassion programs were not able to operate as they were before. And it took 2 years of lobbying, working very closely with ASA activists, Normal, doing many lobby days, working extremely close with Senator Weiner, who we're so grateful for his leadership on this issue. But finally, after 2 years and a lot of hard work and working very closely, I really want to mention the veteran community that really took charge and are amazing advocates and work so hard to advocate for patients' rights in California specifically, but across the country. But they really won that battle in fighting for compassionate use. And I'm so grateful to now have the opportunity to be able to gift cannabis to patients. Specifically for me, I've also had the opportunity to work with my colleagues to create a sustainable compassion program with ease, and which gives patients monthly care packages of compassion donated product from our brand partners. So they take the time and the money and effort to designate this product as compassionate use. We take it and create these care packages and then get that delivered to patient stores on demand, which is a huge feat. And I have to say, it wasn't the easiest thing to do. The thing about the cannabis industry, as many know, it's very complicated and lots of regulations to adhere to. Things, keeping track of records, when it even comes down to the receipt, and also, working with metric as well to keep these things tracked and traced from seed to sale. So it wasn't really plug and play. It's not like, okay, yes, this bill is passed. Now we can just, be handing out pre-rolls on the streets to patients and no big deal. It was really quite the effort, especially on the east side, and, implementing that into our technology. When we first started the compassionate care program, I was taking it upon myself to really do this manually through, many spreadsheets and working directly with the patients and connecting them with the drivers to, manually find the best time for these deliveries to be dropped off. But really grateful for my colleagues at Ease, and Debbie actually was able to participate in this program that I ran late last year of a hackathon where our engineers and staff came together to make a sustainable compassion program that I'm so proud to be a part of. Another thing that's so important, when looking at legalization is equity, and how we best serve folks that were marginalized and mostly impacted by the war on drugs. And the most important thing to do in that, in that realm is really providing job training, legal resource, and most importantly is capital for these folks to, really get a leg up in the legal market and be able to, build generational wealth through this opportunity. And I'm also very grateful for my colleagues that implemented the Momentum Business Accelerator Program. This is our second year. We're just about to wrap up. We chose 10 underrepresented founders to go through a 12-week training program facilitated by Ease. also connecting them with the with our ecosystem, and also investor mentors, and also providing them with a $50,000 grant. So we're wrapping up this year's program, and we were really excited this year to expand this program nationally, and really grateful to have representation from operators in Michigan, New Jersey, and New York. So very excited for these things to continue, and grateful for opportunities to better address the legal market as it comes online.
Thank you. We're going to go to the Q&A portion. And thank you for, Ease is doing just such great work. I just want to say, in California with all your programs, and just thank you so much. I have one question, but please feel free to use the chat function for Q&A. There's also right next to where it says chat polls, it says Q&A. You can also add questions there. I have a question from someone. How did you overcome the argument that allowing delivery will lead to more crime, robberies, for example? What precautions do delivery services have to take to avoid being robbed?
That is a great question. Thank you for raising that, actually. I appreciate that question. And one of when looking at our data, it's our incident rate for Ease delivery drivers is a 0.001% incident rate. And looking at other operators in the space and delivery, and thinking about the protections that are implemented on delivery drivers in particular, everything is tracked and traced, as I mentioned, through metric, of course, and also GPS tracked by the dispensary that they operate from. All of these delivery drivers, none are have any paraphernalia on them, or say any Cannabis or their company that they work for. They do legally have badges that states that they are delivering from that specific dispensary with the license number. Also, when thinking about connecting them specifically with the customers, there's protections there to making sure that the product is getting into the correct person's hands. So from the beginning of a customer signing up to be on the Ease platform, they're verified that they're actually the real person that they have their ID from, and also checking that ID as well when they go to deliver the product too. So there's many steps, and I think the most important part of that is the technology behind it that makes it extra safe and able to be tracked in real time.
Okay, I thank you. I have another question. Probably for you, Rep. Rabhi. What are some of the most challenging regulatory issues facing patients today in regards to access? And what are some of the areas where states and local governments are maybe over-regulating certain things?
Yeah, I mean, of course, that's a pretty big issue. The fact that in the state of Michigan, it's really up to local control in terms of whether communities decide to opt in or opt out of allowing for cannabis businesses to operate in their communities. And there's still a lot of really misconception and fear mongering that exists out there, especially in more rural communities, small towns that aren't as comfortable with allowing for cannabis businesses to open. And so that's really been one of the main issues that we've been facing. What we're trying to show is that communities that were early adopters, such as the city of Ann Arbor, we've seen a massive economic benefit from that, whether it's looking at the fact that, especially now during this time of pandemic when businesses have been shutting down, we've been able to keep our cannabis businesses open. They're paying rent, they're paying taxes. Those taxes are helping to support our local community. Not to mention the fact that the way that Michigan's law is set up is a certain portion of the excise tax that goes in above and beyond the 6% sales tax. There's also an excise tax on cannabis. A portion of that goes directly to the county and the city that those businesses are operating in. And so really what it does is it creates an incentive for communities to want to be cannabis friendly and open up, their communities for cannabis businesses. But unfortunately, it is a slow process, and it is taking community by community, that we're going to have to approach this in that way. And unlike, parts of Western United States where they don't have townships, here in the state of Michigan, we have townships. Every county has townships, and then there's cities as well. So you have to either go to the city or you go to the township board, or sometimes it's a village board, and you have to get approval from them in order to open your business there. And so there are some regulatory hurdles in that way. We do have very devolved forms of governance here, but we're working slowly through that. And I think it is a matter of really showing the benefit to these local communities from an economic perspective and from a taxing perspective, that it is really, it's not what people, perceive or have in their minds, that is oftentimes antiquated. So it's about updating these local officials' mentality around cannabis.
Right. Thank you. And what has Michigan organized on affordability programs or strategies to reduce cost of medicine for patients?
Yeah, so I see that question in the chat around product too. That's definitely a concern, is as the transition, especially has occurred from medical to recreational. There's been all kinds of issues with, because at first when we transitioned to the recreational market, there was no product that had been grown, tested, and approved through the metric system, it's called. And so there was the need to use basically some medical product that had been approved through the medical system and transfer it into the recreational market. And so that impacted sort of the cost, right, of medical cannabis versus rec cannabis. One thing I would note is that in the state of Michigan, we do have two systems, separate systems for medical and recreational. So, there you have to have, different counters. It's a different process. It's a different system that the cannabis goes through. And it is also a different taxing structure. So we've kept it in the state of Michigan where there isn't the same excise tax on medical cannabis as there is on recreational. You do still have to pay the sales tax, the 6% sales tax, but there is that reduced cost automatically if you have a med card to be able to access that cannabis in the state of Michigan. One quick note that's not on this topic that I do want to mention to build off what was said earlier, equity is really important in this space, and it's something that I always like to talk about because we have a justice problem, not just in the state of Michigan, but across this country in the cannabis space. Frankly, cannabis business ownership right now is not representative. It is too white. It is too male-dominated. We need to open the doors to more people to be able to access business ownership opportunities. They want to emphasize that because it's not just about hiring Black and brown workers in your businesses. It's about making sure that the business down the street can be owned by a Black individual or a Latino or Latina individual, particularly because we need to make sure that those over-targeted communities that were targeted during the war on drugs are being given opportunities to cross that line into ownership and being able to build that generational wealth, as was said earlier. We need programs that target people that have criminal records in the cannabis that maybe are in jail or were in jail or incarcerated for cannabis crimes that are no longer crimes. We need to be giving them easy access to licensure so that they can continue in this space. It's only what's right. And that's one of my big priorities here in the state of Michigan, too.
That is awesome. Michigan is so lucky to have you. Yes.
Thank you.
Everything you said is just amazing. Yes, thank you. Thank you for caring about patients and caring about equality. And thank you so much. I think we have time for one more question. No, we don't have time for one more question. I'm sorry. But thank you guys so much for being here. Thank you for everything that both of you guys are doing to help patients get access. And yeah, we really appreciate all the work that you're doing.
Thank you so much, Debbie. Thank you for having me.
Thanks. Bye, guys.
Thanks for having us. Bye.
Bye.